Coming up on Have a Heart, the next time you pick up a flyer at your favorite restaurant or out on the street or at a store, read it carefully. What you read could change someone else's life. Also, we'll meet a hardworking mom who is keeping her family together while caring for a son with multiple disabilities. All this, your phone calls, all interactive next on Have a Heart. Well, hello everybody. I am Bob Racer, and this is Have a Heart. Every day we serve as an interactive town meeting, reaching out to caring and concerned individuals like you who might make a difference in somebody's life. We try to bring together people in need with you, our family of viewers, in an effort to make their lives a little bit better. Now, you can feel free to join in on the conversation here at America's Talking. That's what we want you to do. You can reach out to us on our Sprint phone lines. Talk to me, talk to the guest, but take part. And the number is 1-800-988-TALK. That's 1-800-988-8255. And please call us. Raising a child with a disability is certainly tough enough. Our first guest is a mother who is raising a son with two disabilities, epilepsy and autism. Please welcome Jewel Howard. Jewel, welcome to the show.
Thank you.
Thank you so much for coming over.
It's good to be here. Thank you.
Your son is Seneca.
Yes, it is.
And how old is Seneca?
Seneca is 12 years old. And
tell me about him. I know you.
Well, yes. Every mother likes to talk about their children.
Oh, of course they do.
Seneca is a 12-year-old boy, male boy. He's weighs 265 pounds. At the age when he was born.
Now he's a big boy.
He's a big boy
because of
his disability and the medication that he's on. Seneca has, like you said, multiple handicaps. He's autistic, number one.
Well, is that what he had when he was born?
When he was born, no one can tell whether your kid is autistic or not. You have to go through like as they age, like through the 0 to 6 months, and you notice this difference in the thing, in everything. But my family, we noticed something was wrong because we have two other children. Seneca wasn't reacting like a normal baby would.
So you were already an expert twice over.
Yes, and I come from a huge family, of 12 kids. So, and it's a lot under me, so I know about kids. And as Seneca got older, something just wasn't right. And he cried all the time. His speech wasn't no speech. He had a behavior problem because I guess he was angry.
Yes.
And that's a third handicap he has. His phase of behavior disorder.
Okay.
He has 3 handicaps. We tried placing him as a parent. I didn't know where to turn. Nobody could give me any answers, where to go. I wanted to get him in school because I thought, like, at 3, he should be in some kind of support in a school and they placed him in a school, but that wasn't the right school for him.
When did the epilepsy come about?
Well, the epilepsy came about when I went to the doctor. She told me, she said, "Mrs. Howard, have you seen Seneca having any seizures lately?" And I said, "Well, I know sometimes he stares into space and he gets stiff. I thought that maybe he just wanted to be alone." She said, sometimes
because of the symptoms from his autism.
I was just placing that with that. She said, he might be having a seizure then. And I said, a seizure? She said, yes, he might have epilepsy. I said, and this is enough for me. Yeah. So she told me to watch him very closely now because he's coming into the teenage. And I'm very fearful, I'm scared, because I know epilepsy. I read a lot about it, and I had some friends when I was young, would fall out and shake and everything.
Yeah, what did you know about epilepsy before the doctor?
What I had read basically in the magazines or
seen in the movies.
Seen in the movies.
Yeah, and Cleopatra. That's where I learned that epilepsy. Caesar had epilepsy.
I had a girlfriend in high school that had. We just called them. They was having a fit. We didn't know it was epilepsy, but that's what it was. She would just out of the blue be sitting there. She would just pass out and started shaking. So you were really frightened, and there was a lot of stigma attached to this too. And then the thing is society out there, it makes parents like me want to pull back because they don't understand, and you have this kid and you're taking them out, and if he fall out, you know, the society is cruel, and I don't want that to be for my son to be, you know, because I have to be the one to, you know, take the jokes and the puns. And if anybody that does have a handicapped child, they understand where I'm coming from. And I would like for the society to know that we need help.
We have a caller. Kathy, are you there? Kathy?
Yes.
Kathy, welcome to Have a Heart.
Yes.
Do you have a comment, Kathy?
Yes, I had a question.
Yes.
Hi. I wanted to ask Jewel. I had a question.
Yes, go ahead, Kathy. Your television set is turned up. That's why you hear yourself twice.
I wanted to ask Jewel what kind of strain her son's handicaps have caused on her family.
Thank you. What kind of strains has this caused on your family?
Well, like I said, my other two kids, basically my time was spent with Seneca, taking them to the doctor. If he stays sick more often than the rest of the children, I had to make sure that I was always there. If the school called, I always had to be home, and I always had to have him around me, because he was just like a little kid. I couldn't leave him alone in another room by himself. If I had to go somewhere, I had to take Seneca with me.
Sure. And the other kids
feel
that.
Yes,
and you feel it. You feel like you're not doing your job, or what you want to do as a mother.
Yes, you want to be.
It's not so much a job.
Yeah, you want to be Superwoman, but you know you can't.
Yeah, you can't. Well, I'd like to introduce you to another mother who's a terrific lady, and she knows exactly what you're going through. One of her children also suffers from epilepsy, and she's the national celebrity spokesperson for the Epilepsy Foundation of America. I want you to welcome, from Days of Our Lives, Jamie Lynn Bauer. Jamie, come on in, please. Welcome to our show.
Hello.
So nice to have you here.
Thank you very much.
Nice to meet you, Jamie.
Jewel Howard.
Nice to meet you.
You too, Jamie.
I'm really proud of you.
Oh, thank you. I'm proud of you too, Jamie.
It's a hard thing.
Yes, it is.
Yeah, especially when you have multiple children.
Yes.
Because even if you have a child like mine who's not as not severely affected, it really changes the dynamics of the family. It makes it very difficult on
Well, tell us
children.
about that, because our caller wanted to know especially that. It sounded like our caller had a history or a problem that she might be coping with.
Well,
how does it affect your family?
it affects, for instance, a marriage, in the sense that very frequently when you're dealing with a handicapped child, one parent is in denial, and the other one is left then to be the basic caregiver for that child. So they're very isolated, because they can't even discuss the things that are happening with the doctors, the tests, the decisions and choices they have to make. They cannot discuss with their partner, because the partner doesn't want to hear about it, or their partner doesn't want anyone to know, not even the other family members, much less trying to make things simpler at school and see that your child is understood. In the case of my child, you look at my child, you would never know there was anything wrong with my child at all. But, and I'm going to, for the sake of my child's privacy, I'm going to call him John.
Okay.
John would have difficulties because of medication. In his case, you mentioned your son gained a lot of...
As we want to be very clear, Jewel's son has multiple disabilities.
Yes. But the medications that are given for instance, epilepsy are very serious medications, and they can cause all kinds of side effects. They're the largest problem in certain cases. Like with my child's personality has been altered by the medication that we finally found that controlled his seizures. He only gained, in the first 5.5 years of being medicated, he only gained 8 pounds. So because in the case of John, he was underweight, he was harassed and teased and beaten up and called stupid, and because it took a number of years to find a medication that would control the seizures.
From the other kids?
Yes, they thought he was
stupid. Does this
stupid.
sound familiar? Yeah.
Well, mine wouldn't know what the other kids were saying, because he's not that good at verbal.
But affecting the family.
But it affected me. It affected me.
Yeah.
And you don't. And I didn't know whether other children wanted, if they would go outside with him, and if he would, say sounds that he made and things that he did. I would, you know, watch. I didn't want them to feel ashamed because that was their brother. You know, that was a part of our family, and I wanted them to love, you know, and, you know, see, but other people, like I said, society out there, you know, is cruel. And, you know, there are children that we love them, and, you know, with all disabilities and all that, you know, I don't see the disability because I'm the mother.
Well, Jamie is here for the Epilepsy Foundation of America, and we're going to learn a lot more about this and learn that the stigma is very ill-placed. Still to come on Have a Heart, we're going to meet later on in the show a dance instructor who was told she would never